Hello, welcome to Eastside Wellness Active Series. My name is Dr. Rafel, and we're going to go over an exercise today called the 3D shoulder mobilization, and it's by Gray Cook. The first part of this in the position is critical. We want this patient knee and hip at 90 degrees. If it's below 90 degrees, they're just going to torque their low back area, okay? So as we bring this up, you'll notice too, there's also a pad under this patient's knee, because if I let the knee drop down too far, again, I'm going to put too much torque on the low back. So as the person's knee and hip is at 90 and they're stacked shoulder over shoulder, if you could kind of stack your shoulders a little bit better for me, then what I'm going to have them do is grip their own rib cage, twist far as they can, exhaling as they go. I want them to blow all their air out as they do this. It's critical. If you don't get all the air out, you're not going to get full mobilization of your T-spine. Okay, that's part number one. Now we're going to move right into part two. Okay, first the arm's going to come straight up. Do that for me. And a critical part here is that the shoulder must be stacked. Show an improper stacked shoulder. From here, you're going to teach the shoulder to move improperly. It cannot be near your ear. So you need to tighten this muscle and pull that shoulder down away from your ear. Make your neck long. If I'm looking straight off the side and straight forward, we're going to split that or go at 90 degrees, or I'm sorry, 45 degrees, split the 90, and she's going to reach back at that angle best she can. Now, she has full mobilization here. A lot of you, the patients, will not, so come back just a bit. Let's say you're locked here and can't go any further. Instead of thinking, I'm going to force my arm down, what I want you to think instead is I'm going to reach long. As you reach long but still keep the shoulder set position, you'll find that the shoulder starts to seek toward the ground. Now when you come back, don't come back straight back from this. That's a little too much stress on that shoulder. Bend the elbow, come back this way. Okay, let's do part two again. The second part of the three-part. You're going to reach back at a 45-degree angle. Perfect. Okay. Now, the third part starts the same, and this whole time you'll notice this lower body never changes. Patient is again going to reach back at a 45. This time, as best you can, you get the back of your hand to the table or to the floor in this case. If you can't get at that angle, allow your arm to come back until the back of your hand can touch. Then you're going to internally rotate the hand now so the palm of the hand's on the floor. Okay? Straighten the elbow, sweep behind your back. You're going to come up your back as high as you can. There's going to be two things that limit this. One, if I hit pain. Two, if the palm of my hand leaves. So keep coming up higher. As you do, your elbow can even kind of come out a little bit more, not even up, but kind of out. Okay, so her palm is just starting to leave the ground right there. She's at maximum range. Okay, now you're going to sweep high the other way into internal rotation. You go as high as you can and still keep the back of the hand on the ground. If the back of the hand comes up, that's too high, stop. If you run into pain, stop. Okay, once we're at full range of motion, elbows locked, she's going to internally rotate the palm down as far as she can, turn the doorknob, then turn the doorknob the other direction as far as she can. That's the three-part series. Thank you.